Program, Dr. Linus Ndegwa, chair of the Kenya Dental Association, is urging his colleagues to stop operations except for emergency cases. Well, he now joins us live for more details on the same. Dr. Linus, many thanks for joining us on Weekend at 1. Why do you want delivery of dental services stopped?
Thank you, Michelle. I think we had sent out a message as Kenya Dental Association to mention that we should stop doing all routine dental procedures. The main reason is that we are trying to stop the spread of the virus. As you are aware, even when the virus is being tested, it's done through the oral, it's done to the mouth and the nose. So you can imagine the virus is more concentrated around those regions, and for that reason we are saying that we should stop all routine dental procedures.
So how will that impact, overall service? Because dental service at the end of the day are quite, essential services for those who suffer from dental issues.
Yeah, we totally agree that it is an essential service, and we always recommend that you should see your dentist at least twice a year. But this is not the time to get your annual checkup. This is the time to follow the government directives in terms of staying at home, to also do our part to stop community spreading. We have allowed emergency dental procedures, those that result in severe pain, that you are able to contact your dentist and they'll be able to guide you on how you can have that treatment done. Currently, we are urging that most level 5 and 6 hospitals are the ones who are allowed to perform such procedures, obviously because the level of preparedness is very high, as opposed to private dental setup.
All right, and you talk about, germs and, possible viruses being concentrated, around the mouth area. Talk to us about the use of masks, especially now in the wake of the COVID-19 pandemic. Many have not been using them in the correct way, many not protecting themselves in the correct manner. How should we use these masks?
So the current guidelines for case definition is being given by the Ministry of Health, and it keeps changing based on the presentation. But it also informs the need to wear a mask and which one. For us, since we are directly in contact with patients, we need a higher level type of mask, what we call the N95 mask. And those are basically for patients who present with respiratory illness. For those who do not have respiratory illness, you can use a surgical mask. Again, like I mentioned, the case definition keeps changing. Initially, it was usually spread by droplets, and now there is evidence to show that it stays in the air, and that is the reason why most people would want to wear a mask. So you'd mostly wear a surgical mask, a 3-ply one.
All right, many thanks. That is Dr. Linus Ndegwa, chair of the Kenya Dentist Association in Kenya, also asking his colleagues to stop with immediate effect all dental operations, except in the case of emergencies.